You woke up this morning, stretched your arms, maybe checked your phone, poured yourself a cup of coffee, and started your day. Just like every other morning, nothing felt wrong. Nothing felt different. But here is what I need you to understand before we go any further. Your brain may have spent the last 7 hours slowly suffocating, not dramatically, not in a way that would have woken you up, not in a way that showed up on your face or made your heart pound or triggered any alarm in your body that you would have consciously noticed, just quietly, silently, incrementally, less oxygen reaching your brain cells with every single breath you took while you were asleep. And this morning when you woke up, you called it tiredness. You called it age. You said to yourself, I just didn't sleep well, and you moved on with your day. I am Dr. Scott Franklin, and what I just described to you is not rare, it is not unusual. It is happening to millions of Americans over the age of 60 every single night, and the overwhelming majority of them have absolutely no idea. Over the years, I have spent reviewing cardiovascular and neurological research specifically focused on adults in their 60s, 70s, and beyond. I have seen one pattern that keeps appearing in the data that almost nobody in mainstream medicine is talking about openly in a way that actually reaches the people who need to hear it most. And that pattern connects directly to something so simple, so immediate, and so completely within your control that I genuinely believe sharing it today could change the trajectory of someone's health. Here is the core of what I want to tell you today. There is a 30-second test you can do every single morning before you even get out of bed. It costs almost nothing. It requires one small device that you can order online for less than the price of a dinner out. And cardiologists and neurologists who study stroke prevention are increasingly saying that the information this test gives you predicts your stroke and cognitive decline risk more accurately, more immediately than many standard blood tests your doctor orders once a year. I want to walk you through exactly what this test is, exactly how to do it, exactly what your numbers mean, and exactly what to do if those numbers are telling you something your doctor needs to know about. But before I do that, I need to give you the foundation. Because without understanding why overnight oxygen levels matter so deeply, the test itself is just a number. And a number without context doesn't save lives. Understanding saves lives. So let me ask you something right now. When was the last time you woke up and genuinely felt restored? Not just functional, not just okay enough to start the day, actually rested, clear-headed, energy present from the moment your eyes opened. If you are struggling to remember, I want you to stay with me, because what I am about to share may explain something you have been quietly living with for years without ever connecting the dots. Here is what happens inside your body during sleep that most people do not fully appreciate. Sleep is not passive. Your body is not simply waiting for morning. During the hours you are asleep, your cardiovascular system is performing critical maintenance. Your brain is clearing toxic waste proteins through a system called the glymphatic system. Your blood pressure is supposed to drop 10 to 20% in a process researchers call nocturnal dipping. Your cells are repairing. Your immune system is recalibrating. Your arterial walls are recovering from the mechanical stress of a full day of circulation. All of that maintenance, every single bit of it, runs on one fuel, oxygen. And here is where the problem begins for adults over 60, in a way that it simply does not for younger people. After 60, several things change simultaneously in ways that compound on each other. Your airway muscles lose tone. The soft tissue in your throat becomes more relaxed during sleep, making partial obstruction more likely even in people who have never been formally diagnosed with sleep apnea. Your respiratory drive, the automatic signal your brain sends to your lungs to keep breathing deeply and regularly, becomes slightly less aggressive. Your arterial walls stiffen, meaning the vessels carrying oxygenated blood to your brain are less flexible and less forgiving when flow is even slightly reduced. And your brain itself, after decades of use, has a higher baseline of metabolic waste that needs clearing overnight. What this means practically is that a 62-year-old sleeping in a slightly wrong position, in a room that is slightly too warm, after a dinner that was slightly too late, after one glass of wine that slightly dilated and then constricted their blood vessels, can experience repeated small drops in blood oxygen saturation throughout the night that individually feel like nothing but collectively amount to hours of suboptimal oxygen delivery to some of the most sensitive tissue in the human body, and they wake up the next morning and call it getting older. Now here is the statistic that I want you to hold on to as we move through this video together. According to research published in the American Journal of Respiratory and Critical Care Medicine, adults who experience nighttime oxygen desaturation events, meaning drops in blood oxygen below 90% for sustained periods during sleep, face a significantly elevated risk of stroke, cardiovascular events, and accelerated cognitive decline compared to adults whose oxygen remains stable overnight. The difference between those two groups is not always diagnosis. It is not always treatment. Sometimes the only difference is awareness. One group knows their numbers, the other group does not. Drop a comment right now and tell me, have you ever checked your oxygen levels before? Yes or no? I read every single comment, and your answer is going to matter in just a few minutes. Before I show you how to do this test, I need to make sure you understand why your doctor has probably never specifically instructed you to monitor your overnight oxygen levels at home. Because this question comes up every single time I discuss this topic, and the answer is important. It is not because your doctor does not care. Most physicians caring for older adults are genuinely committed to their patients' well-being. The issue is structural. A standard annual checkup measures your oxygen saturation once, in a brightly lit exam room, while you are sitting upright, fully awake and at rest. That single measurement tells your doctor almost nothing about what your oxygen is doing during the 7 or 8 hours you are horizontal, unconscious, and breathing without any conscious control or awareness. It is the equivalent of checking your car's engine temperature once in a parking lot and concluding everything is fine without ever putting the car on the highway. The tools that do measure overnight oxygen comprehensively, formal sleep studies and polysomnography, are expensive, require a referral, involve sleeping in an unfamiliar lab environment, and have waiting lists that in many parts of the country stretch for months. So for the vast majority of Americans over 60 who are not experiencing dramatic, obvious symptoms, this monitoring simply never happens. And in that gap, problems develop slowly and invisibly until they are not slow or invisible anymore. Here is the science you need to understand about why oxygen levels during sleep are so uniquely critical for brain health and stroke prevention. Your brain accounts for roughly 2% of your body weight, but it consumes approximately 20% of the oxygen your body takes in at any given moment. It is extraordinarily hungry tissue, and unlike your muscles, which can function for short periods using alternative energy pathways when oxygen drops temporarily, your brain neurons have almost no tolerance for oxygen deprivation. Even mild, sustained reductions in oxygen delivery begin affecting neurological function within minutes. Now think about what happens when oxygen saturation drops during sleep repeatedly over months and years. First, your brain cells operate under chronic low-grade stress. The mitochondria inside each neuron, the tiny structures that produce cellular energy, become less efficient. Neurons that are chronically under-oxygenated begin producing inflammatory signals. Those inflammatory signals damage the interior lining of blood vessel walls throughout the brain, a process called endothelial dysfunction. Damaged vessel walls become stickier. Platelets are more likely to aggregate, small clots are more likely to form. And small clots forming in already stiffened cerebral vessels in a 68-year-old brain are not a theoretical concern. They are the precise mechanism behind what neurologists call lacunar infarcts, tiny strokes, often completely silent, that accumulate over years and eventually express themselves as memory loss, balance problems, personality changes, and cognitive decline that everyone around you attributes to normal aging. Second, the glymphatic system we discussed earlier operates almost exclusively during deep sleep, and deep sleep requires stable oxygen. When oxygen fluctuates during the night, your brain's ability to enter and sustain the deep sleep stages where glymphatic clearance happens is directly compromised. The waste does not get cleared. Amyloid beta proteins, tau proteins, the same biological markers elevated in Alzheimer's disease patients accumulate, not because of genetics necessarily, not because of destiny, but because the brain's overnight cleaning cycle was interrupted night after night by an oxygen problem that nobody ever measured. Third, and this is the piece that connects most directly to stroke risk specifically, oxygen desaturation during sleep triggers what researchers call sympathetic activation. Your autonomic nervous system, sensing reduced oxygen, responds by releasing stress hormones including adrenaline and cortisol. These hormones raise your heart rate, they constrict your blood vessels, they spike your blood pressure. This is your body's emergency response mechanism, and it is designed for short-term crises. But when it is triggered repeatedly throughout every night because your oxygen keeps dipping, you are essentially running a low-grade physiological emergency for hours at a time on a nightly basis. The American Heart Association has directly connected this pattern of nighttime sympathetic surges to accelerated arterial stiffening, elevated morning blood pressure, and increased risk of plaque rupture and vulnerable arterial lesions. That last one matters enormously. Plaque rupture is the triggering event in the majority of ischemic strokes. The plaque was there, perhaps for years, but something caused it to rupture and release its contents into the bloodstream on that specific morning. Research increasingly suggests that the hours of physiological stress immediately preceding waking, driven by overnight oxygen instability, are a major contributing factor to why strokes cluster so heavily in the morning hours between 6 a.m. and noon. Your sleep position plays a direct role in all of this. We know that back sleeping, particularly flat back sleeping without elevation, increases the likelihood of airway narrowing. We know that stomach sleeping reduces tidal volume, the total air your lungs bring in with each breath, by compressing your rib cage against the mattress for 8 hours straight. We know that the fetal position restricts diaphragm movement and compounds neck vessel compression simultaneously. And we know that left side sleeping with proper head elevation is the position most consistently associated with stable overnight oxygen and optimal airway maintenance in adults over 60. Now, before we move to the actual test instructions, let me ask you this. Are you currently a back sleeper, a side sleeper, or a stomach sleeper? Tell me in the comments right now, because your sleep position and your oxygen numbers are connected in a way that is going to become very clear in just a moment. All right, this is the section of this video that I want you to pay the closest attention to, because everything I have shared with you up to this point has been building toward this, the actual test, how to do it, what to look for, and what your numbers are telling you. The device you need is called a pulse oximeter. If you have ever been in a hospital or a doctor's office and had a small clip placed on your fingertip that glowed red and showed a number on a small screen, you have already used one. These devices are now available over the counter without a prescription for anywhere between $15 and $35 on Amazon or at any pharmacy chain across the United States. They are small enough to fit in a drawer. They require nothing more than a standard AAA battery, and they measure two things simultaneously: your blood oxygen saturation level, displayed as SpO2, and your pulse rate. Here is exactly how to perform the morning test correctly. Before you do anything else when you wake up, and I mean before you sit up, before you reach for your phone, before you go to the bathroom, before you speak to anyone, while you are still lying in the same position you woke up in, clip the pulse oximeter onto the index or middle finger of either hand. Make sure your hand is relaxed and resting at roughly the level of your heart, not hanging off the side of the bed or raised above your head. Wait 30 seconds. Do not move. Do not speak. Breathe normally. Read the number. That number, that SpO2 reading taken in the first 30 seconds after waking while your body is still in its sleep state, is one of the most honest snapshots your cardiovascular and respiratory system will give you all day. Now let me tell you exactly what that number means. 95 to 100%. This is the healthy range. Your overnight oxygen delivery was adequate. Your body had sufficient oxygen to perform its restorative functions. If you are consistently in this range every morning, your nighttime respiratory and cardiovascular baseline is solid. Keep doing what you are doing and keep monitoring, because numbers can change as we age. 92 to 94%. This is the borderline range, and it deserves serious attention. A reading in this zone is not an emergency, but it is your body telling you that something during the night is creating enough respiratory or circulatory resistance to bring your oxygen meaningfully below optimal. At this level, your brain's glymphatic clearance is likely being affected. Your sympathetic nervous system is likely being activated repeatedly overnight. Your morning blood pressure surge is likely more pronounced than it needs to be. If you are seeing numbers in this range consistently, meaning 3 or more mornings in a row, this is a conversation you need to initiate with your doctor. Bring your oximeter, bring your logged readings. Tell them you have been monitoring your morning oxygen and describe the pattern. A physician who sees consistent 92 to 94% morning readings in a patient over 60 has clinical reason to order a formal sleep study. Below 92%, this is the range where I want you to take immediate action. A morning SpO2 reading below 92% is a medical signal, not a reason to panic alone at home, but an unambiguous reason to contact your physician within 24 hours, not at your next scheduled appointment, not next week, the same day or the next morning. Research from the journal Chest found that patients with consistent nocturnal oxygen desaturation below 90% had a stroke risk elevation that was statistically significant and clinically meaningful. Below 92% on a resting morning reading is too close to that threshold to ignore. Now here is where I want to add an important layer to this, because a single reading is informative, but a pattern is powerful. I recommend keeping a simple log, nothing complicated. A small notebook beside your bed or a note in your phone. Every morning for 2 weeks, record 3 things: your SPO2 reading, your pulse rate, and 1 or 2 words describing how you feel: rested, groggy, headache, fine. After 2 weeks, you will have a pattern, and patterns tell stories that single data points cannot. For example, if your oxygen is consistently lower on mornings after you ate late the night before, that is a direct connection your body is making visible. If your readings are worse on mornings after a glass of wine, your body is confirming the alcohol vasodilation cycle we discussed. If your readings are better on mornings when you slept on your left side versus your back, you now have personal evidence, not theory, not someone else's study, your own biological data, confirming that position directly affects your overnight oxygen. That is extraordinarily powerful information to bring to a doctor's appointment. I also want to address one common question right now. What if your reading fluctuates slightly, say between 94 and 97% on different mornings? That is normal variation. You are not looking for a single alarming number. You are looking for a consistent pattern of readings below 94%, readings that trend downward over days or weeks, or a single reading below 90% at any point. One more thing worth knowing about this test. Your pulse rate reading is secondary data that adds context. A resting morning pulse above 80 beats per minute consistently suggests your sympathetic nervous system is staying elevated overnight. A resting morning pulse below 60 is generally positive and indicates your heart is working efficiently. These numbers together, oxygen plus pulse, give you a two-dimensional picture of your overnight cardiovascular state that most people over 60 in this country are simply never seeing. Go ahead and type the number 3 in the comments right now if you are going to get a pulse oximeter this week. I want to see how many of you are ready to start actually measuring what is happening inside your body at night. Now that you understand what to measure and what your numbers mean, I want to make absolutely sure you leave this video with the tools to actually improve those numbers starting tonight. Because information without action is just anxiety, and I am not in the business of making people anxious. I am in the business of giving people something they can do. Let me walk you through the 5 specific changes that research consistently shows have the most direct and measurable impact on overnight oxygen saturation in adults over 60. Change number 1. Switch to left side sleeping tonight. This is the single highest impact sleep position change you can make for overnight oxygen. Here is why. When you sleep on your left side, your airway geometry improves. The soft tissue in the back of your throat is less likely to collapse partially under gravity. Your diaphragm has more freedom to descend fully with each breath, meaning every breath delivers more air to your lungs. Your heart sits in its natural orientation without gravitational displacement, and your inferior vena cava, the large vein returning blood from your lower body to your heart, is free from compression. If you have never been a side sleeper, use a full-length body pillow in front of you. Hug it gently. It prevents your body from rolling back onto your back during the night. Place one pillow between your knees. This keeps your spine neutral and prevents the hip pain that often causes people to abandon side sleeping within the first 2 nights. Give this position 7 consistent nights. Your body adapts faster than you expect, and your morning oxygen numbers will begin to reflect that adaptation. Change number 2. Elevate your upper body 15 to 30 degrees. If left side sleeping is genuinely not possible for you due to shoulder arthritis, joint pain, or severe discomfort, elevating your upper body is the next most effective intervention. A wedge pillow placed under your entire upper torso, not just stacked pillows under your head, creates a gradual incline that accomplishes 3 things simultaneously. It reduces the pooling of blood and fluid that increases intraocular and intracranial pressure during flat sleeping. It keeps your airway more open by positioning your throat at an angle that resists soft tissue collapse. And it improves venous return from your lower body, reducing the cardiovascular workload on your heart overnight. An adjustable base for your mattress achieves this even more effectively and is worth every dollar for anyone over 60 dealing with sleep apnea, morning headaches, or consistently low morning oxygen readings. Change number 3. Finish eating 3 hours before bed, alcohol 4 to 5 hours before. We discussed the physiological mechanism earlier, but I want to connect it directly to your oxygen numbers now. Late eating keeps your digestive system actively demanding blood flow during the hours when your brain needs stable circulation most. Alcohol causes a vasodilation and rebound constriction cycle that destabilizes your blood pressure throughout the night, which directly interferes with your body's ability to maintain consistent oxygen delivery to your brain. These are not lifestyle opinions, these are measurable, documented physiological events that show up in your morning oxygen readings within 1 to 2 nights of changing the pattern. Test this yourself. Eat late and have a drink one night. Measure your morning oxygen. Eat early and skip the alcohol the next night. Measure again. Your oximeter will show you the difference more clearly than I ever could. Change number 4. Keep your bedroom between 65 and 68 degrees Fahrenheit. A cool sleeping environment is not just about comfort. A lower room temperature helps your core body temperature drop, which is the biological trigger for entering and sustaining deep sleep stages. Deep sleep is where your glymphatic system operates most actively and where your respiratory drive is most stable. A room that is too warm keeps your body in lighter sleep stages, where breathing is more irregular and oxygen fluctuations are more frequent. This is a free change that costs you nothing except the willingness to reach for the thermostat. Change number 5. Remove screens 60 minutes before bed. Blue light exposure after 9 p.m. suppresses melatonin production and delays your entry into deep sleep by up to 90 minutes. That is 90 minutes of your potential glymphatic clearance window eliminated before you even close your eyes. The brain waste that should have been cleared during that first deep sleep cycle stays, night after night, year after year. This is not a technology lecture. This is oxygen and brain chemistry speaking directly to your daily habits. Now here is what I want you to do right now, today, before this video ends. Write down one number, the target you are going to hold yourself accountable to every morning. 95% or above. That is your goal, that is your baseline. That is the number that tells you your brain got what it needed overnight. And starting tomorrow morning, before your coffee, before your phone, before anything else, clip that oximeter on, wait 30 seconds, and read your number. If you are in the healthy range, celebrate that and keep monitoring. If you are in the borderline range, make the sleep changes I just walked you through and recheck in 1 week. If you are below 92%, call your doctor today. Show them this video if it helps start that conversation. Bring your logged numbers, advocate for yourself. Because here's the truth that I want to leave you with today. Stroke does not always announce itself. Cognitive decline does not always announce itself. The damage that leads to both of those outcomes builds quietly, incrementally, invisibly over years of nights where the oxygen was just slightly too low for just slightly too long. But you now have a 30-second window every single morning to see what is actually happening inside your body while you sleep. And that window is the difference between being a passive bystander to your own aging and being someone who is actively protecting their brain, their heart, and their independence every single day. Drop a comment below right now and tell me, what was the most important thing you learned in this video today? I read every single comment personally, and your answer helps me understand exactly what information is reaching people who need it most. If this video gave you something your last 3 doctor's appointments never did, please hit the like button right now and share this with one person over 60 in your life. A spouse, a sibling, a parent, a close friend who keeps waking up tired and has been told it is just aging. It is not just aging, and they deserve to know that. Subscribe to Dr. Scott Franklin right now because next week I am covering the 5 warning signs that appear in the first 20 minutes after you wake up, that cardiologists say are being dangerously dismissed as normal parts of getting older. Signs that your body is trying to tell you something specific and urgent. You will not want to miss that one. Until then, measure your numbers, protect your brain, and take care of yourself. I am Dr. Scott Franklin. I will see you next week.